Hi, everyone. It's Dr. Karen, the Women's Midlife Specialist, and we are going to do another lab right now. And this is going to be a fairly short one, but a good one. So let's get started. Okay, this is SD, and she is postmenopausal, 52 years old, and she is currently on bioidentical estrogen, BiEstrogen E2, E3 compounded, and a 200 milligrams of oral progesterone. She used it 9 hours. So you may remember that oral progesterone is basically in the bloodstream for about 6 to 10 hours. So this is a very good, she followed the directions. She used it within the last 6 to 10 hours. So therefore we have a good level for her. Now, let's take a look at her results. With the biestrogen that she's using, she's got an estradiol level of 15. This is slightly high. When you first look at this, you might go, oh boy, that's really high, because optimal is 1.3 to 3.3. Now, I will say that this is ZRT's optimal conventional practice ranges, reference ranges. However, they also recognize that normal is between 0.8 and 12. So she's a little bit high in my opinion. And though 1.3 to 3.3 is optimal postmenopausally, this is for conventional, and quite honestly, we feel very good and safe about running estradiols up to 12. So 15 is a little high. So a little bit of effort to bring this down would be beneficial. Progesterone is at 121. That's within the normal reference range of 30 to 300. But when you look at this high estradiol and a 121, look at this progesterone to estrogen ratio. So once again, I am really happy to get another one of these examples. We're going to have a lot of these where people are estrogen dominant because they're counting on this oral progesterone to do the trick, and it just really doesn't. Then we've got, she does take testosterone. She doesn't say how much, but she does use a topical testosterone and a topical DHEA. So when you look at this testosterone of 525, that is really just excessively high. Now, the DHEA at 14 is a good range. Let's look at her graphs. Okay, so estrogen and progesterone are not shown on here because they are both high, expected to be high with BiEst and progesterone, but they are within normal reference. Well, the progesterone and estrogen, estradiol a little high. Testosterone, they put it on here, but at the 80 mark, but as you know, this is 525. They just wanted to show how high this really was. It's really way up here off the chart. So here is a 30-year-old level, somewhere around 50. You may remember the extensive charts that I did for Kara, my nurse. This is where we want to be, closer in this range. Now, if you're up here, this isn't going, like maybe right here, maybe right here. That's not going to really be a big issue, but because there's going to be some fluctuations during the day. But if you're sitting at 525 first thing in the morning, then, and it's been a whole 24 hours, here's where she put her testosterone on, a whole 24 hours before, you're pretty high. That's a pretty extensively high testosterone. Now, could this estradiol be coming from testosterone? This is a good thing to think about because postmenopausally, she's only 52, but I don't know how long she's been postmenopause. If her ovaries aren't functioning, it's not likely that this testosterone is converting much to this estradiol. The androstenedione can convert to estrone, though, because that occurs in fat cells. It does not occur in the ovaries. So testosterone converts to estradiol mostly in the ovaries. So only a little bit can convert in the adrenal glands, but most of this is going to convert in the ovaries. So postmenopausal for any length of time where you know for sure you're postmenopausal, this elevated estradiol is more likely coming from taking too much or estrone converting to estradiol. With a BMI of 29, that's a possibility because we know we've got some fat cells. We want to get this BMI down. 24 would be a lovely place to be sitting. Okay, so let's look at our DHEA. Now, our DHEA is a topical as well. It may be mixed in with her testosterone, or it may be a separate cream. Commonly, we put it in the same cream, and she's got a beautiful DHEA level. So hers is right here, and I put this arrow where a 30-year-old sits. So again, if you have a DHEA closer to 20, that's still okay too. You're closer to a teenager. If your DHEA is up at 20, that's okay, but her DHEA is fine. And so it's not really high, so we aren't really expecting her testosterone to be coming from her DHEA. So let's take a look at her symptoms. Let's go down here to symptoms. And really what we have is interesting. We've got hot flashes, night sweats, and vaginal dryness, even though her estrogen is high. We've got decreased libido, even though her testosterone is high. And we've got increased facial body hair. We can expect that with an elevated testosterone level. And here's another severe one, decreased stamina. And testosterone gives us stamina. So this is what I meant when I have said many times that symptoms, woman's symptoms can be from too high of levels or too low of levels. So we get the same symptoms if our levels are too high or if they're too low. So her top three complaints, I love this about ZRT. It's showing her top three complaints are both high androgens, low androgens, low estrogen, and progesterone. So we know that that's not the case, right? So we know that they're not low, but her symptoms are because they're too high. So she's significantly estrogen dominant with this progesterone to estrogen ratio of only 8. And so doesn't have enough progesterone. She's got slightly elevated estradiol. We don't know what her estrone is. So the next time she tests, that would be a good thing to add is estrone. She's got too much testosterone, but her DHEA is very good. So what should we do? All right. Well, we've got a couple of options to solve the estrogen dominance right away. She can actually just switch from what she's using with the Prometrium or the 200 milligrams of progesterone that she's using orally, as well as this E2, E3 compound. She could just switch to Hormone Heaven and she'll get balanced. Within 3 months, all of this will be balanced. I don't know about the testosterone because that's something separate that she has to do. Or if she wants to stay on her current BiEst and oral progesterone, then she needs to add Hormone Protect at 2 pumps twice a day to resolve this estrogen dominance. Either way, though, whether she goes straight with Hormone Heaven and goes 2 pumps twice a day at minimum, or stays with her current BiEst and oral progesterone and adds Hormone Protect, she needs to reduce her testosterone cream. And I'm going to guess, this is a guess, about 1/4 of her current dose. So if SD is on, say, 4 milligrams a day, 1 milligram would be more reasonable. But keep the same DHEA dose. That DHEA is excellent. All right, so I hope this helps you, SD, and I hope this helps a lot of other women out there who are having symptoms and see that their levels are high and trying to make sense of it, and also seeing how simple it is to get balanced by a cream, young hormones, that you can just go right to and pop right on and get balanced right away. These are balanced very nicely for these postmenopausal women. It's going to be pretty straightforward. Okay, thanks so much, guys. Give me a thumbs up. Let me know I'm doing a good job here for you. I've gotten this recording and all this writing down pretty well and got the program figured out. So we're on a roll, and I'm going to try to give you 2 videos a day until we are done with everybody that hopped on board and has me reading and interpreting their labs for them. So glad you're with me, and I'll see you soon. Bye-bye.